Hello, my name is Dr. Dewan S. Raja. Today I will discuss multiple choice questions in head and neck from 21 to 35. All the question has been taken from the textbook. I will attach the link in the description bar of my video. Also, I have a book on multiple choice question. It is called Anatomy Test Paper. If you are interested, you may collect the books and I will attach that also in the description bar. Okay, let's start the multiple choice questions. What is the nerve supply of the outlined muscle? This is the outline muscle. What is this muscle? This is the orbicularis oculi muscle. Okay. What are the choices? Ophthalmic nerve, facial nerve, maxillary nerve, oculomotor nerve, optic nerve. What is the answer? This is the muscle. This is the muscle of facial expression. So answer should be facial nerve. Okay. Now our second question is here. The second question. The spinal root of the accessory nerve innervates which of the following muscle? A. This is the platysma. B. Sternocleidomastoid muscle. C. occipitofrontalis muscle. D. Posterior auricular muscle. And E. Superior auricular muscle. So, what muscle is innervated by the spinal root of the accessory nerve? Answer should be B. The sternocleidomastoid muscle. Question number 24. Buccinator, an important muscle of the cheek, essential for drinking, eating and blowing. What is the motor innervation of the buccinator? Mandibular nerve, maxillary nerve, facial nerve, glossopharyngeal nerve, vagus nerve. Again, this is a muscle of facial expression. Okay, like blowing. So this is innervated by the facial nerve. Okay, we got that. Now here, which of the following muscle is inserted to the pterygoid fovea? Lateral pterygoid, medial pterygoid, temporalis, masseter. Answer should be lateral pterygoid muscle. Okay, we got that. Now identify the highlighted area in red. This area, this is a fossa at the base of the skull. Okay, in the middle cranial fossa, center of the middle cranial fossa. Okay, what is that? Sphenoidal sinus, that is this. Pituitary fossa, this is this, the red area is the area for the pituitary gland, and this is the outline, the bony outline of the pituitary fossa. Posterior ethmoidal air cell, no, that is not posterior ethmoidal cell. Frontal sinus, that is also not. Posterior clinoid process, that is should be here. This is not the case. This is the fossa, and that is the pituitary fossa. Okay, it lodges the pituitary gland. Okay, so if we go there, let me try here. Okay, we got the pituitary gland. Now here is an X-ray. Okay, identify the highlighted red structure. This part. Is it superior articular facet of C1, inferior articular facet of C1, odontoid process or dens of C2, superior articular facet of C2, transverse process of C2. This part is the superior articular facet of C2. Answer should be D. Okay. This is the odontoid process or dents. Okay, we got that. Now we'll be here. A 45-year-old woman had difficulty to depress and protrude the mandible. She had restricted side-to-side movement of the mandible. Which of the following muscle has horizontally oriented fiber? Depresses and protrude the mandible. So, horizontally oriented fiber, it depresses and protrude the mandible. Answer should be what? Temporalis, medial pterygoid, lateral pterygoid, masseter. What is the answer? Lateral pterygoid. C is the answer. Okay, we got that. Now, here, which of the following structure passes through the mandibular foramen? This is the mandibular foramen. Auriculotemporal nerve, mesenteric nerve, lingual nerve, inferior alveolar nerve, mylohyoid nerve. Okay. What is the nerve? The inferior alveolar nerve. That is the answer. Okay. We got the answer. Inferior alveolar nerve that passes through the mandibular foramen, inferior alveolar nerve with the inferior alveolar vessel inside. It goes through the mandibular foramen. Okay, we got that. Now here, which of the following structure is attached to the lingula of the mandible? What is the lingula? This is the lingula. This is the site of attachment of what ligament? Stylomandibular ligament, sphenomandibular ligament, pterygomandibular raphe, superior constrictor muscle. Our answer should be what? To the lingula. This is lingula of the mandible. Okay. Site of attachment, one side of the ligament, that is the sphenomandibular ligament. This is the answer. Another side is attached to the spine of the sphenoid bone near the foramen spinosum. So lower end is here, attaching the sphenomandibular ligament. Okay, we got that. And the stylomandibular ligament attaches along the posterior border. Okay, so we got that. And we have the third molar area. We'll get the superior constrictor muscle and the pterygomandibular raphe. Okay, we'll get the mylohyoid line above pterygomandibular raphe and the superior constrictor muscle around this part. Okay. Anterior belly of the digestive is innervated by what nerve? By the mandibular nerve. Why? Because it is derived from the first pharyngeal arch, not from facial nerve, not from ansa cervicalis. Ansa cervicalis is a loop of nerve that supplies the strap muscles of the neck. Hypoglossal nerve that supply the tongue muscles. Ansa cervicalis, okay, it came two times, we can avoid this. Okay, so this may be out. So answer should be anterior belly of the digestive by the mandibular nerve. Okay. Okay, I can take it out. Okay. So this is out. Okay. So answer should be the mandibular. Okay. We got that. Question number 31. Question number 32. Which of the following nerve is related to the medial side of the neck of the mandible? Medial side of the neck of the mandible. Okay, neck. Which of the following nerve nerve is the lingual nerve, nerve to the mylohyoid, facial nerve, auriculotemporal nerve, hypoglossal nerve. Answer should be auriculotemporal nerve. Okay, we got that. Then we'll go to another one question. Okay, which of the following foramen transmits terminal part of the greater palatine vessel and the terminal part of the nasopalatine nerve? What is that? Incisive foramen, greater palatine foramen, lesser palatine foramen, foramen ovum, foramen spinosum. Answer should be incisive foramen. Question number 33. Okay, we got that. Question 34. Which of the following muscle is inserted into the apex and medial surface of the cornoid process of the mandible, extending downward to the anterior border of the ramus of the mandible? Answer should be the what? Temporalis masseter, lateral pterygoid, medial pterygoid, Buccinator. What is the answer? Okay, answer is here is A, temporalis muscle. Temporalis muscle. Okay, we got that. Now, okay, which of the following muscle is inserted into the lower border of the body of the mandible and is innervated by the cervical branch of the facial nerve? What is that? Posterior belly of the digastric. Okay, that does not insert into the lower border of the body of the mandible. Okay, and that is anterior belly of digastric from the digastric fossa, innervated by the mandibular nerve, innervated by the facial nerve. Okay, but it does not insert into the inferior lower border of the body of the mandible. The mylohyoid muscle, attachment to the mylohyoid line, geniohyoid muscle, attachment to the genial tubercle. So answer should be Platysma. Okay, and that's all about the MCQs of head and neck from 21 to 35. If you have any question, please feel free to ask me, and I will request you all to go through the textbook for your good conception. I am adding the link of the textbook in the description bar of this video. I have also a book that is called Anatomy Test Paper containing 1870 multiple choice question specifically for the USMLE, also the postgraduate examination of any countries. So if you are interested, you may collect them. Okay, so thank you very much. Please support my channel. Please subscribe me. Have a nice day. Bye now.